As a care home manager, it is so important that we encourage staff, social care staff, to have their flu and COVID vaccines, just to keep everybody as safe as we possibly can.
There's been lots of information that's been incorrect that has circulated on social media platforms. And unfortunately, when that information is out there and people hear it and it's repeated, particularly if it's repeated by people they trust, they believe in that information which is incorrect.
Some staff are vocal that they don't want to have it. It's their choice, but as much as possible, we do encourage them. But
they needed to be supported in their choice by getting the appropriate information and understanding why the vaccines are so important.
Again, it's that message of getting across to staff that although you might still get COVID, hopefully you're not going to get it as bad. People say they've had the flu, and unless you've had real flu, you don't know the difference.
Unless you've seen someone that's had it, and you can realise then what can happen if you turn these things down, when all they're trying to do is to help.
Again, it is really important to encourage the staff to have their vaccinations, because if they're not, they're getting poorly for a lot longer, which means they could be potentially missing income. And that, it's a real strain on care staff who don't get paid an awful lot of money. When you are in an outbreak situation, it is really difficult because there's a lot of extra work because you're reporting it, you're managing your rota, you're making sure you've got enough staff on duty.
it's really hard for everyone to cope with.
You're also looking after the families coming in, because the families are really worried. They want to know what we're doing to minimise the risk.
I don't want my husband put on, into a sort of risk situation because someone doesn't think that it's important for them. I mean, everybody has a right to make decisions about themselves, but I think when you're in a job caring in an organisation like this, you have to think about the impact of your health on the people that you're working with.
I'd like to know they've had their jabs as well, because being stuck in the bed as I am, I'm in their hands anyways.
I think it's made a huge difference for when staff have their vaccinations. Not only are they not feeling ill, they're not going off sick, which obviously impacts the care that we can give to the residents. The residents aren't so poorly because you're reducing that risk of something coming into the home. So I am really passionate in making sure I do as much as I can. The staff work 12-hour shifts, so it's really difficult at times to get to their own GP. So we work really closely with our GP practice.
It's our duty to the other residents, and we're all looked after. So, yeah.
Look at the people around you. Do you have vulnerable people, family members, friends? Do you think, maybe you not getting the vaccine could put them at risk, maybe?
It will help all of us, the residents and us as an employees.
It's a protect for ourselves and people who are around us. So I say to them, please get a COVID vaccination.